Good morning, everyone, and thank you for joining the Kentucky Hospital Association and the Kentucky Statewide Opioid Stewardship Program for our Emergency Department Bridge Program Kickoff Webinar. We are excited to have you join us today. My name is Melanie Landrum. I'm the Vice President of Data and Health Information Services here at the Kentucky Hospital Association. Along with me today is my colleague, Emily Henderson from Kentucky Hospital Association, pharmacist and the owner of this outpatient or the ED bridge program. And then we also have a special guest with us today who's going to present Dr. Katie Marks from CORE. Today, we will be recording the call so that we can put this out on our website and share it with everyone, because we want to be able to let everybody know about our emergency department bridge program that we are going to be sponsoring for our Kentucky hospitals across the state. So thank you so much for joining us today, and we will get started. I'd like to again introduce Dr. Katie Marks, our partner with us, to start the program and talk a little bit about the Kentucky opioid response effort and our collaboration. Dr. Marks.
Thank you so much. And I also want to extend just a really sincere welcome and thank you to everyone for being a part of this discussion around this healing work. As you heard, I serve as the project director for the Kentucky opioid response effort. I'm also an assistant professor at the University of Kentucky in the Department for behavioral science. What I'd like to do is just spend a few minutes, just 5 or 10 minutes with you, talking a little bit about CORE and setting up the story of why, how we got to where we are with both CORE and this work, share a little bit of our vision for the project, and just kind of give you my extensive gratitude throughout for the work that's already being done, because I know there's a lot of partners on this call that can speak to this work specifically. So CORE lives in the Department for Behavioral Health, Developmental and Intellectual Disabilities within the Cabinet for Health and Family Services. We are funded through a series of SAMHSA grants, the Substance Abuse and Mental Health Services Administration, and have been in operation since 2017. In fact, I know that we have a lot of partners on this call that have engaged with CORE work through a variety of initiatives. We actually contract with over 60 entities in Kentucky and have 157 distinct projects that we're working on. And to give you a sense of scale, the statewide opioid stewardship project, which includes nearly every hospital in Kentucky, is just one of those projects. Our mission has been guided by SAMHSA's directive and support, which is to increase access to high quality evidence-based prevention, treatment, recovery supports, and harm reduction services with the goal of reducing opioid-related overdose deaths in Kentucky. We do that by funding targeted initiatives that focus on the full continuum of care and prioritizing specific populations, people who've experienced an opioid-related overdose, pregnant and parenting women, those who are justice involved, and those who are minoritized or marginalized in our communities. And that's why this work with the hospitals places the emphasis squarely on the emergency department. And I need not share the overdose statistics with this group, but just to emphasize how hard hit we are specifically in Kentucky. We currently have the second highest rate of overdose in the state. So the vision for this, we know that hospitals have long been at the forefront of the opioid crisis by seeing the overdoses, the opioid-related complications, the infectious disease and endocarditis that is hitting your doors. And we know it's taken a toll on everyone as a result, right? Patients with OUD itself aren't receiving treatment. In fact, they're often discharged without withdrawal services, increasing risk for overdose. Practitioners haven't had the capacity or the support they've needed to care for this medical condition like they care for other medical conditions, and hospitals absorb the costs of untreated substance use disorders. And we also know that stigma has been entrenched in all of these parties, right, by structurally reinforced fallacies of helplessness and hopelessness. But we know that people aren't simply failing our treatment system. We know that the system is failing them. We've demonstrated that low barrier person-centered services work. We know that assertive outreach and engagement works. And we know that specific strategies like placing naloxone in the hands of those at risk for overdose or treating opioid withdrawal through buprenorphine works. And so that's why the bridge model, the bridge clinic model, is really a solution for everyone that I've described. And again, I almost wish I could pause and just allow some other folks to chime in and speak specifically to what they've already seen in their communities. So there's a couple pieces of the bridge clinic model that you'll hear today, but I want to emphasize a few. And the first is that we treat opioid withdrawal as the medical emergency that it is. Not only does this save lives, but it enables patients and practitioners to participate in the system of care. It supports long-term health and wellness, and it mirrors the way we serve other healthcare issues. The bridge model also leverages the unique capacity of people with lived experience to engage and support in service access. And sometimes folks think that the bridge clinic model is just peer support or just care coordination, but it's not. It's one piece of this model. We've seen hospitals try to do peer support alone, and it's not sufficient. Because what we know is that we are also placing tools in practitioners' hands to manage the symptoms of opioid use disorder. And I hope everyone has heard very recently that SAMHSA and at a federal level, the X waiver is no longer required to prescribe buprenorphine. So we continue to see reduced barriers to that service. And the bridge clinic model is also inclusive of the principles and strategies of harm reduction, where all paths to health and wellness are supported, and we empower people through education about how to decrease their own risk for future overdose or infection. And last, it infuses a deeper level of humanity in our hospital culture. And so I'll end with just saying that I'm incredibly grateful for CORE's partnership with the Kentucky Hospital Association. You'll see through the story of both the statewide opioid stewardship and now this, the presence of content expertise, the leveraging of a board that's comprised of the folks on this call, people in the field doing the work day in and day out, and also folks with lived experience. It brings together the leadership of hospitals and allows us to scale that which works. And so I'll turn it back over, but thank you so much again for your commitment to this work. I regret that I can't stay on for the entire call, but I wanted to extend my gratitude specifically for Lucy Letton, who is our core treatment implementation specialist and will be participating in answering questions. Thank you so much.
Thank you so much, Dr. Marks. Again, on behalf of Kentucky Hospital Association and all of our hospitals, thank you for your efforts in this opioid response effort. We could not do this without you and your partnership. So we are so grateful to be able to be on this journey with you and Lucy and the rest of the team. So we appreciate your time. And again, for questions we will take at the end, Lucy will be on to take any questions. And again, Dr. Marks, thank you so much. At this time, I'm going to turn it over to Emily Henderson to walk through the Kentucky SOS program, kind of where we started, where we are now, and where we're going to go. So Emily.
Thank you, Melanie, and thank you all for joining today. This is an exciting day for not only the Kentucky Hospital Association, but also for the Kentucky Statewide Opioid Stewardship Program, or as we commonly refer to it as Kentucky SOS. So a little bit of background about the program. KHA, the Hospital Association, partnered with the Cabinet for Health and Family Services and UK Healthcare, along with core funding, to launch this statewide opioid stewardship program. Kentucky is the first state in the country to have a comprehensive opioid stewardship program for all the hospitals' facilities in their state. We're very proud of that, and the initial focus of the program has and continues to focus on reducing opioid overprescribing while improving safe opioid use. Initially, the program began in the inpatient side, and the hospitals worked hard and continue to work reducing overprescribing and improving their opioid stewardship efforts. Then the program grew to the outpatient hospital-owned primary care clinics. And then as today we are announcing the program's growing again, and we're excited to announce about the emergency department or ED bridge program. Kentucky SOS has and continues to collaborate with partners and stakeholders all across the state and in other states. Obviously, other core funded programs we work with. The program also works with various state work groups and task forces and community partners. The community partners that you work with in your communities and all across the state, again, we also do work with other states as well. So, as mentioned, KHA partnered with the Cabinet and UK Healthcare to start the program. The program is overseen by an advisory committee. This is a multidisciplinary group that is comprised of core representatives, Dr. Marks and Dr. Brenzel, then an ED physician, behavioral health clinician, senior leaders, nursing, pharmacy, addiction specialist, pain management provider, and most important, patient advocate in long-term recovery. So decisions are made and vetted with this advisory committee, and we're all working together to improve opioid stewardship in the state. In 2019, the program launched a on-the-road trip across the state for 5 regional training meetings. They were in Louisville, Lexington, Hazard, Paducah, and Bowling Green. There was a social media and press release campaign to announce the program, and that continues. I hope you are on various social media outlets and see KHA's press releases and information about Kentucky SOS. Banners, you should see freestanding banners in your high traffic areas. We distributed those. Those talk about the Kentucky SOS program, the goals. It also has a QR code that your patients and their families can go to link them directly to Kentucky SOS website, which is a public website. Kentucky SOS does have a logo. We try to promote that on every type of publication that we do, so that not only is it recognizable by you, providers and clinicians and staff, but also by our patients and their families, so they know the hard work and efforts that hospitals in the state are doing regarding opioid stewardship. I mentioned the website. Go check it out if you haven't been to it. It has lots of resources and toolkits, links to other core funded programs that's constantly being updated. The SOS program does have data requirements. There is an encyclopedia of measures that defines the definitions. Monthly data submission began in January of 2020. So we have lots of data to look at to see where needs improvement or where successes are happening. The program prides itself on having educational best practice webinars that focus on the entire healthcare spectrum of disciplines regarding opioid stewardship, physical therapy, pharmacy, OB, ED, nursing, patients and family. That's just the beginning, but those are all on the Kentucky SOS website. And as always, there's ongoing technical assistance, coaching, training with not only KHA staff and other state, but also peer-to-peer learning between facilities, and direct link for provider to provider or pharmacist to pharmacist. So there are lots of resources that this program calls for. On the inpatient side, it is a prevention focus using of alternatives to opioids in the emergency department, among other things. Also, when this program, we've had this question, oh, you say not to use opioids. That's not what this is. The Kentucky SOS program is opioid stewardship, that if opioids are warranted, to use judiciously and for specific diagnoses and duration. But if a patient is naive, if there are other ways to treat them without using opioids, let's use alternatives or non-opioid treatments to treat their pain. So there is data submission, and you see on your screen various data that the hospitals submit, especially concurrent e-prescribing with the use of upon discharge opioids plus benzodiazepines or 2 or more opioids at discharge, alternatives to opioids in the ED for common presentations, and then the use of opioids or not using opioids for select surgical procedures. Again, there are monthly webinars posted on the website. So go check those out. And the program distributes by email, electronically, monthly newsletters. So we love hospital highlights. If you have a highlight, please send it to us. But if you're not getting the newsletter, it's all things about Kentucky SOS. Please contact me so you can get on that list to stay up to date with what's going on in the state regarding opioid stewardship. Again, the inpatient focuses on ongoing communication, technical assistance, connect ED providers to other ED providers, OB, peer-to-peer learning between facilities. And then one specific form of education that we've had in the summer, fall of 2022, and we hope to continue as a tele-echo opioid stewardship education with the University of New Mexico. And anyway, there's more information on that. So be on the lookout for hopefully a new cohort. We've had 2 cohorts and one looking for more to come. On the outpatient side, that is growing. And again, the cabinet approach Kentucky SOS to implement and to work with hospital-owned primary care clinics. Thank you to ARH for being the pilot health system. For that, we began this program of the this arm of the program in 2021. The 6 building blocks program is a team-based approach using evidence-based care to consistently and efficiently treat patients on long-term opioids and chronic pain patients. Again, if a patient's naive, though, we want our primary care providers to, if they can, keep them naive and use other forms of treatment to treat their pain. Again, this side of the program, again, deals with peer-to-peer learning and education. I'll probably sound like a broken record, but we have found that we learn from each other and we grow from teaching and learning from each other. So we're working very hard in the state to work collaboratively and be partners in this effort. So again, we pride ourselves with being able to connect primary care providers with other primary care providers. They're on the front lines, they're seeing these patients daily, and let's work through this. There is a data submission, again, with this part of the program with the outpatient. You see on your screen the various areas, and also you'll notice that there's a duplicate about a patient that's on long-term opioid therapy also receiving a prescription for benzodiazepine that mirrors the inpatient side. We know best practices are not to have this combination of medications. So we are working hard in the state, looking at these patients and seeing how we can best treat them using evidence-based best practices. And all of our data goes into KHA's data collection system called Kentucky Quality Counts. And here's just a brief overview of the 6 building blocks program. It was actually developed by the University of Washington Department of Family Medicine and the Kaiser Permanente Research Institute, and they received state and federal funding for this. It was a combination of family practice physicians and other clinicians that did this. And it helps primary care practices implement consistent patient-centered evidence-based care for chronic pain patients on long-term opioid therapy. So this program, as mentioned, is evidence-based, and it was mentioned in several, with SAMHSA and IHI and different resources for use, hence why the cabinet suggested that Kentucky SOS implement this with the primary care clinics in the state here in Kentucky. So we'll go through the 6 building blocks. Obviously, there are 6 blocks, and you'll see the different ones: leadership and consensus, the policies, patient agreements, workflows. So this program helps to look at maybe revise or improve workflows, policies, patient agreements. The program tracks and monitors patient care. Of course, that's by data. And then the next blocks are planned patient-centered visits. This supports patient-centered and communication for care of patients on this chronic therapy. This helps facilitate those difficult conversations that providers and staff may have with patients, and this program will help support those difficult conversations. And then caring for the complex patients that when a person does have opioid use disorder or has mental health or behavioral health issues, that they are referred to resources that they are needed. And then lastly, measuring success and obviously sustainability. Of course, that's with data, peer-to-peer learning, ongoing education, technical assistance, as we do with both the inpatient and with outpatient primary care clinics. But today, we are here to announce and to launch the ED Bridge program. So again, there are ED Bridge programs currently in the state. However, the cabinet approached Kentucky SOS to increase the number and expand these programs across the state. And we have accepted that challenge. So thank you for being on this webinar to learn more about the ED Bridge program. Kentucky SOS has and continues to receive funding and assistance from CORE. The focus and goal of the ED Bridge program is to be a patient-centered approach to immediate access to begin MOUD and help patients begin their recovery. There are currently 11 bridge programs in Kentucky. And again, as the program states, we love to learn from each other. So we will be learning from them, look to their successes, what barriers they encountered, and learn from them. This program intends to model from other ED Bridge programs. We have been in conversations with Michigan, Pennsylvania, California, other states. However, we're going to make this specific to Kentucky. We know that we have differences and we see different types of patients, and there are different disparities exist here in our state, whether it's rural versus urban or different sizes, and we will tailor this program accordingly. It will be ever changing, as it was with the advent of the inpatient program and with the outpatient primary care clinics. So we set the groundwork. We have ideas that we want, but they are fluid and ever changing to make specific and to make relevant for our Kentucky facilities. And then also this program intends to provide funding for peer support specialists in the acute care EDs. And these are people that Dr. Marks mentioned are in long-term recovery. They've walked in their shoes. They know their feelings. They are the liaison between the patients and clinicians, and they're an integral part for patients that are beginning their journey to recovery. So keys to success that I see for this ED Bridge program, like the inpatient and outpatient, are obviously engagement, constant engagement, not only from KHA staff, but from others in the state, ongoing communication and assistance. And we are going to be flexible and tailor this program to be successful like our inpatient and outpatient programs have been and continue to be. So you'll notice on the screen, this is a brief overview of the ED Bridge program with the goals to obviously treat and connect patients and change the culture in Kentucky's emergency departments so that, you know, we don't have the stigmatizing or labeling, that everyone's welcome and that we're here as clinicians, as staffers, providers to treat all patients. So all of us on the call know that substance use disorder is a chronic illness, just like type 2 diabetes and other illnesses. And studies have shown that initiation of buprenorphine in EDs prior to community discharge increased the rates of linkage to outpatient treatment over just brief or just mentioned interventions. So again, so we plan to start treatment, and you see there, we'll help provide treatment protocols to EDs and try to remove barriers and things like that. Also connect patients to ongoing care. This is where the peer support specialists come in. The Kentucky SOS intends to provide training and support to prepare these peer support specialists. Also will help develop patient materials for all health literacies and all patients that present to the ED. Change the hospital culture, obviously providing education to providers and staff regarding harm reduction, trauma-informed care, using non-stigmatizing language, things like that. And then building your bridge program. I want everyone on the call today to start thinking, who is your champion? Who can you see that can help build a team? And we definitely want multidisciplinary, think about inpatient and ED providers, pharmacy, nursing, care management, security, possibly senior leaders, social workers, different ones that can build a team to build your bridge program in your facility. We know that Dr. Marks mentioned about barrier removed regarding the X waiver, and more information to come about that because there are new training requirements for all providers. These requirements will not go into effect until June of 23 of this year. So Kentucky SOS, we will plan to have education and webinars around this, but more information to come on that. And then also we plan to measure and communicate success. Again, that's with data collection into Kentucky Quality Counts. The Kentucky SOS team will review the data, will look at successes, areas that needs improvement, and walk right beside you to help build and plan a successful ED bridge program. And then sustainability. No program is worth its weight unless there's a sustainability plan. And that's obviously with the Kentucky SOS staff to link with existing bridge programs so we can build on each other, and also to keep in contact with our peer support specialists and just work together as a team to improve our opioid stewardship efforts with this ED bridge program. There will be a data collection portion with the ED bridge program on your screen. These are ideas. We still need to discuss this, to be honest, with the advisory committee, and we'll vet these ideas. But because of core funding, the program must produce outcomes, and data is how we do that. So we've done that in the past with our inpatient. We are beginning that with our outpatient primary care clinics, and we will have a data portion with our ED bridge program. Again, these are just ideas, so don't set these in stone, but there will be education around the inputting data into Kentucky Quality Counts and things like that. So more info to come. But how are we going to get started? So you will receive a baseline assessment survey for the non-existing bridge programs. There are 11 in the state that have bridge programs. If you're not one of those, you will be receiving a baseline assessment survey today from me. I will email the ED directors and the quality leads, quality directors today. If you do not receive that, please contact me. My contact information is at the end of the slides. And also with not only the link to the electronic survey, you also receive a PDF. And I know that some facilities like to print it off, and you may want to complete it or speak with other teammates, collaborate and work together with other departments to answer it. That's fine, but then go back and enter it electronically and hit submit. So we're giving you 6 weeks to complete this survey. It will be due Friday, March 10th, and I will send reminders because we want 100% survey completion. We just want one survey per facility. Many of the answers, you'll just click an answer, yes or no, or just select all that apply. There are some drop-down boxes. There are a few areas for more explanation. If you need to explain, please do that. The purpose of this survey is so that we, as in Kentucky SOS, we can see where you are and what resources are needed for successful bridge implementation. We are aware of time constraints and we know everyone's busy, but if you could please take time and be as thorough as you can, because this helps us to help you. So here are a couple of example survey questions. Obviously, these look at social services, but you can see it's either a yes or no. The other topics may be screening protocols and prescribing practices for patients with SUDs. One topic of questions is on harm reduction. Another topic of questions is on training for ED staff. So it goes through all aspects, and we, the Kentucky SOS team has collaborated with many others to have a comprehensive survey to be as streamlined as we could have it, but also to get the necessary relevant information. So again, look for that email today from myself, and then also put on your calendar that it needs to be submitted by March 10th, which is a Friday, and you've got 6 weeks to complete it. So I think I've mentioned twice about the existing bridge programs. So here are the existing bridge programs in the state of Kentucky. We are proud of these bridge programs, and the program plans to interview these bridge programs to not only learn about the barriers they've experienced, but to learn about successes they are having, and just to have an overall opportunity to learn. And again, utilize peer-to-peer learning when we're implementing new bridge programs. Melanie and I will meet with the ED directors and others in these facilities that are listed on your screen by Zoom. We'll set up appointments. So we will have a one-on-one interviews, so to speak, with these, and so that we can learn. We're constantly learning, ever changing. And I'm just so grateful, and thank you for being on this journey with us, because we're growing together. So again, the goal is to have an ED bridge program in every acute care hospital in the state over time. This will not happen in one day. We didn't get to this. We didn't get to this opioid crisis in one day, but we do. The program does have plans, and we are streamlining the plans. So again, Kentucky SOS knows that this will not be implemented overnight, but we will work beside you as we have with our inpatient and as we are doing with our primary care clinics to learn together. And, honestly, now with the addition of this ED bridge program, Kentucky SOS has really grown to encompass the entire spectrum of care for patients in Kentucky. From the inpatient side, we look at the prevention focus and judicious use of opioids when necessary. For the outpatient side, the primary care clinics and treating patients with chronic pain consistently and using alternatives to opioids for opioid naive patients. Now to the advent of the ED bridge program, helping those patients with opioid use disorder or those presenting in overdose situations receive medical care and begin their journey to recovery. So we want every patient in the state to have healthy lifestyles, not only for themselves, but for their families and their communities that you serve. So we are really proud that this program has grown now to this third arm to essentially encompass the entire spectrum of care for patients as it relates to pain treatment and pain control for our patients. Again, this webinar is recorded and it will be posted on the website. It will also be on we'll post it on the KHA Daily Update, and we'll send it out to the Kentucky SOS distribution list. If you are not receiving emails and information about webinars and things, newsletters, things like that, and you want to know about all things Kentucky SOS, contact me, please, to get on that. You see our Kentucky SOS team. We are small but mighty. We have Melanie Landrum, who is Vice President of Data Services. and she oversees the program. Stacy Allen is a pharmacist, and she works with the inpatient side. Shanna Jaggers is a pharmacist and works with the outpatient primary care clinics. Marilyn Connors is a primary care physician, and she also works with the outpatient primary care clinics. And then myself, Emily Henderson, I'm a pharmacist, and I will be working with the ED Bridge program. You see our emails on there. Please contact us anytime, and we are here to help. And then I'm going to pass it to Melanie so we can have questions, comments, things like that.
Great. Thank you so much, Emily. We appreciate you going through that program and announcing our big launch of, again, our next area of where we are going to take this opioid stewardship journey in Kentucky. This is exciting times to be able to work with our hospitals across the state, provide support, provide funding, so that you can implement a successful bridge program in your hospital for your patients that come into your hospitals. So again, to wrap up, next steps, you will receive an email with a baseline survey. Again, as Emily mentioned, this is to understand where hospitals are today. We want to get a good understanding of where you are within this program, and it may be nowhere, and that's okay. You may be doing parts of it and you don't even realize it's a part of it, but we want to understand where that is today with each of our hospitals. So you'll get that email from us with a survey link. Again, one person from your facility should fill it out. You will get a PDF so that you can look at the survey beforehand to see kind of who you need to ask questions to, and then you'll submit that online. If you don't like the online process, if you want to print the PDF, fill it out and send it back to us, that's fine too. We will take it either way. If your hospital's interested, and we've already had people reaching out to talk about this and really say, I want to be a hospital that you work with first, please let us know your interest. We know that you might be along the journey further than we think, some are, and we want to be able to put you on that list to say, hey, these are the top 10 hospitals that are ready to go today, and we'll start working with those. But again, our goal is to spread this across the Commonwealth so that every acute hospital has an ED Bridge program of some sort within a time frame. And we haven't given ourselves a deadline because, again, we know this is going to take time to do, but if you are interested in starting this immediately, please let us know. So fill out that survey, let us know your interest. We will start doing some educational webinars, so you'll start to see those pop up on your calendar. So we want to make sure, again, you're getting all the information that you can about this program and do this journey with us. So at this time, I'm going to stop. And we'll open up for any questions that you have, feedback. Are you excited about this program? We have emojis now on Zoom, so you can give us emojis if you're excited about this program. One of the questions in the chat box, you can either unmute or put questions in the chat box. One question that we do have already in the chat box is the participation required to be a part of SOS? The answer is we would like all acute care hospitals to, again, join us on this journey to start a bridge program at some point in time. It may not be today for your hospital, but that may not be that it's not 6 months or a year from now. This will be kind of the third portion of the SOS, and people are in different times and different journeys. As you saw with everyone's doing the inpatient, as you saw with the outpatient, we've got a couple of health systems already doing it. We're building that out. So if you're interested in that, but again, we want to, across time, make sure all acute care hospitals have some sort of bridge program established in their ED. Other questions, feedback? Again, you can unmute yourself or put it in the chat box. We will also send a copy of the presentation out to everyone when we send the survey link. The recording will be available on our website, the Kentucky SOS website, which is www.spelloutkentuckysos.com. Can I see some emojis? What's your feedback? Is this exciting for you guys to know that Kentucky is going to spread this across the state? Any thumbs up or smiley faces or any kind of emojis today? There we go. Now we got some. Lucy, is there anything that you would like to say before the end of the call today?
No, just that we're very excited about this. This has for a long time been a missing piece to our core mission of kind of saturating the state with services that will address the opioid epidemic. And so we're very excited to be part of it. We'll be looking at funding some of your programs over the next year to help get this started. And we don't have the money for everybody for year one anyway, but we will do our best to take those of you who are really interested and who have a real excitement for this. I will emphasize something that we talked about earlier, which is in developing a champion. What we find is that the most successful bridge programs are those who have somebody at the helm or somebody within the emergency department who really sees this as important and really looks for opportunities not only to promote it internally, but has the eyes to see patients walking through the door who are in need of services. So that's what we look for in a champion for this purpose, and it's really something that we look forward to helping develop for all of you.
Thank you, Lucy. Any other questions or feedback at this time? Well, again, we appreciate your time today, jumping on the webinar to learn about our new program for our statewide opioid stewardship program. Be on the lookout for that email here shortly from Emily Henderson and the KHA team. And again, we hope everybody has a great day. Thank you so much for joining, and we'll talk to everyone soon. Thank you.